Welcome, my dear friends. Myself is Professor Dr. Rajendra Deshpande. Today is the 27th of April 2020, and today's topic is regarding the research study design. As you know, everybody, that in Ayurveda, all the subjects, starting from the Samhita, Siddhanta, Rachana, Kriya, Dravya Guna Vijnana, Shastra, Nidan, and up to the Kaya Chikitsa, Panchakarma, Shalya, and Shalakya, we have the MD and MS courses, post-graduation courses. And for all these students all over the India, they have this subject for the prelim examination, that is the research methodology and medical statistics. I have already discussed something about the question bank regarding these two sub-subjects, like I can say research methodology and medical statistics. So one of the topic of which is always discussed, which is always asked in the written examination as well as in the viva, that is about the research study designs. In your synopsis, the actual word is plan of work. There also you will have to mention what is your research design. That research design is very much important to make your systemic operating procedure, that is SOP. Okay, so we will discuss today this topic with lot of examples. Rather, I can say I will use the one example at least for each type, and that will make you the remember of that particular types. Okay, so myself is Professor Dr. Rajendra Deshpande. I am MD in Ayurvedic Medicine and Ayurvedic. Just a moment. I will open my, yes, okay. Myself is Professor Deshpande. I am MD in Ayurvedic Medicine and Ayurvedic Physiology. So this is my WhatsApp number. And you can contact me through the mail, professordeshpande@gmail.com. We can have these paid services from me, personal or online health problem advice like Ayurvedic consultant, then preventive measure, lifestyle counseling based on your Ayurvedic biotype, and also with your hands, that is palmistry. That I also do the palmistry. Personal or online classes of medicine as well as Ayurveda. And finally, every time I request that please don't forget to ask your friends and relatives to subscribe my YouTube channel. My dear friends, this is the book edited by myself and Professor Dr. Ranade sir. That is the Research Methodology and Medical Statistics is the book available by Manakarnika Publication, Pune, Maharashtra State, India. This book has the authors Sachin Sarpotdar, Dr. Sachin Sarpotdar, Professor Dr. Santosh Bor, Dr. Professor Mrs. Ila Bor. So all we have made this book, and which is exactly according to the present syllabus of Central Council of Indian Medicine. Each and every point of the syllabus is included while writing this particular book. I think nearly 5th or 6th edition is going on right now. This is the last page of that book. Then let us start with the proper topic, that is research study design. Basically, understanding this topic is nothing but the understanding of terminology. Terminology is very much important. There are mainly two types of our research. One is only observational and second is interventional. Remember, observation just to see, to observe, to note, but we don't include or anything like medicines, therapies, anything we are not included in the with the patient. So whenever we add something or we interact with the patient, we interact with the person with some medicine, with some treatments, with whatever method, and we change their physiological lifestyle or the pathological process, then something added into the process of that person's life, that is called as interventional. But observational is mere looking what is going on with the patient, with the healthy volunteers. So just to observe is observational, and when we put our efforts, any method any treatments, any medicines, then that becomes the interventional. This is the main types of our research projects. You must remember these main two types. Then observational has two types: descriptive type of the research and analytical type of the research. I'm going to give you the details of everything. But remember, observational has two types: descriptive and analytical. But descriptive, only observations, no medicines, no treatment, no experiments, nothing. Then analytical, we are observing something, but then afterwards we make the analysis. We make the analysis, then that is analysis. Then there are three types in this analytical: case control study, cohort study, and cross-sectional study. These terms are always used by the research teachers, research scientists, ethical committee members, and my MD students. They don't answer what is case control, what is cohort, what is cross-sectional. So you must try to understand these terminologies. Then interventional, you can make some laboratorical experiments or anyway experimental things, but you are doing something with the person, with the patient. Clinical trials, very well, everybody knows that clinical trials, any Ayurvedic medicines is given to the patient, and precondition and post condition is observed or is noted in a scientific manner. Okay, so clinical trials, these are the maximum research. Ayurvedic research nowadays is concentrating on these clinical trials. Then animal study, some people they are doing the animal experiments or animal study. And last is a pathological laboratorical study. You understand? So these are the types of interventional research: experimental, clinical, animal experiments, and laboratorical study. Don't forget this slide, my dear friends. This is the most important slide whenever you are talking about any research subject. These are the basic terminologies you must remember. Okay, let us see one by one. First is a observational study. The researcher observes systematically. This word is important because whenever we talk about research, research is a knowledge gaining process, but knowledge gaining in a systematic manner. There should be some discipline, protocol, standard operating procedure, SOP. Then only that is research. Otherwise, simple knowledge gaining by reading some book and nothing have in your mind aim and objectives, then that is not a research. Try to understand. In research, systematic work is very important. Okay, what we are observing: disease. We can observe the disease process. We can observe the causes. For example, corona pandemic is going on right now, and any other parameters which exist naturally. Which exist naturally. For example, I have given the example: water content in Kapha Prakriti. This is one of the project that my MD student had taken. It was just an observational study. We have not given any medicines. We have not done any experiments. We take the patients of different variety, single doshaja, dvandvaja prakriti, and especially we decide there. We use the, what you can say, the there is specific instrument at that time we used, and that scanner was used to decide the water content. Because you know that kapha dosha is basically from Jala and Prithvi Mahabhut. So we wanted to see whether that kapha molecules or kapha prakriti has more water content with compared to the other prakritis. Again, vyapadeshus tu bhuyasa, comparatively more. That is not abnormal, because there is a range of water content. Everybody has a 75% water content in the body. But we want to see whether the kapha prakriti has a more water content than the pitta or than the vata prakriti. Okay, but it was only observation. Then we found out bone density in asthi-sara person. I remember the name of the machine. Write down that name: inner body scan machine. Inner body scan machine. I can even write down over here if you want. I can add this line for you: inner body scan machine is available in the market. This is the name of the instrument. Okay, by which my MD students had done that particular research. Okay. So inner body scan machine, please write it down. Inner body scan machine was used for this, but it is only observational study. This study may be conducted with or without a control group. With or without a control group. That means Kapha Prakriti people and non-Kapha Prakriti people. That can be the control. Asti Sara person and then Asti Asara person. But we have not taken any control group also. It can be taken or it cannot be taken. The investigator does not nothing to affect the outcome, means he does not intervene. We are not changing anything. We are not giving Pravala Pishtivati to change the Asti Sarata. We are not giving any rasayan for the Kapha Prakriti to change its water content. We are nothing intervening. We are not disturbing his physiology and pathology. We are just observing. This study has a specific advantage in clinical safety. This is what is important. This is called as a, what you can say, the preclinical type of the research work. Preclinical type of the research work. So that we can see that what particular things are good for which type of the Prakriti. This is clinical safety purpose. This observational study is always made. Okay. Now, use of such studies to prove the efficacy in limited is limited because bias in patient selection may occur. That means its value is not very high level of importance. It is very basic and fundamental research. So there may be some bias. There may be some bias. If the researcher is not honest with himself, then he can make a bias or the wrong or errors in his research. Then observational study, basically descriptive and analytical. These two words are most important. We will see what is descriptive and analytical. In descriptive, researcher plan to describe an existing condition. As the word says, we are just, I'm sorry, I should wrongly made that. I will correct it, I'm sorry. Okay. What we are doing, we are describing an existing condition. Only description. Data is collected about the disease. Okay. Data is collected on the basis of gender, age, mortality. In Ayurveda, data is collected about the Prakriti and Sarata. Modern sciences, if you open the PSM book, then Park, you write down the name, Park, P-A-R-K. Park has written very interesting book of preventive social medicine, PSM. And he has given a lot of descriptive studies and their results about the modern epidemiological studies. But in Ayurveda, even this type of the surveys and data collection has not been done regarding the Prakriti and Sarata. Try to understand. We have to describe the phenomena or the events on the basis of Prakriti and Sarata. Researcher gather the information from records, okay, or collecting data and merely study it. He just collect the data and try to write down whatever he has seen. Researchers only observe parameters like time, place, and person without testing any hypothesis. This word I will also make. We are not taking any hypothesis. I am not saying that Kapha Prakriti people has more water content or Kapha Prakriti people does not have more water content H0. He has more water content H1. No, I have not decided any hypothesis before starting my research. That is called as a descriptive observational study. Only and only observations. Finish. In descriptive study, information is collected without changing the environment. Nothing is manipulated or intervened. Sometimes these are referred as a correlational studies. Correlation in between Kapha Prakriti and Vata Prakriti. Water content in Kapha Prakriti, water content in the Vata Prakriti and Kapha Prakriti. So it's a correlation. Try to understand. We want to compare, but just by observation. In human research, a descriptive study may provide information of naturally occurring health status, behavior, attitude, or other characteristics of particular group. Here I must write down naturally occurring. Try to understand. Naturally occurring. We are not giving any medicines, we are not giving any treatments. Naturally occurring. For example, how many Europeans are having or seen not affected by corona in England, in Europe, in Germany, in America? I am just observing and notifying my data. And how many percentage of the Indians have affected with corona in the month of, say, for example, April 2020? So this is a just collection of information, naturally occurring health status. I have not given any medicines, I have not given any treatments. That means, what is the normal life span of the American people in 2019? What is the natural lifespan of the Indian people? I am not intervening, I am not changing the event. Are you understanding? So that is something naturally occurring information and gathering of that information. These studies are also conducted to demonstrate an association or relationship between the things in the world around you. Okay? Association. When the corona pandemic started, starting from the December 2019, but at least in India, for example, in the month of April or the March, and it has started going up and up and up. Okay, we wanted to see, or rather we saw that there was a concrete relationship between the corona affected people who have traveled in the month of February, in the month of January 2020, who have traveled to America, who have traveled to China, who have traveled to Europe. And when they arrived in the India, these patients have got corona infection more than the other people in India. So this is something called as a association. Are you getting this word? Association of coronavirus infection with the traveling to the foreign countries, or traveling to the foreign countries which are affected by corona. I think I am giving you the concrete examples. You may write these examples in your answer books and viva. Descriptive studies in which the research interact with the participant may only involve survey or interviews. My dear friend, this word is also important. In this study, observational, maximum time we do the surveys. Maximum time we do the interviews with the people, and then we collect the information. Next is analytical. It is also observational. In this type of research, observe as well as the test hypothesis. Here, okay, I have given the example. Here, it is not only collection of information. Right now, only not collection. One step ahead, one step more. Here we consider some hypothesis, consider some research question. That is, for example, association of various facts like Shukra Sarata and watery eyes. If you open the Shukra Sarata shlok, you will find that they have mentioned that the eyes are very snigdha and anchas. Okay, so we want to see whether in fact really whether the Shukra Sarata, Uttam Sarata, best quality Shukra Sarata, Madhyama Sarata, moderate quality, Hina Sarata, poor quality Shukra Sarata, and its association with the watery content or watery part or water in your eyes. So I have performed this test with my PG student, and we have seen that there is association of Uttam Sarata and watery eyes, water content in the eyes. Okay. Analytical study design is a type of epidemiological study. Write down this word, epidemiological study. Moving in the society and finding the different events. It is most useful in testing the hypothesis, that is association in between human exposure and adverse health effects. I think here I will correct. Association between the human exposure and adverse health effects. Repeat the example of that corona. Whoever are exposed to the foreign countries affected by corona, they get the more association with the present infection. Okay. Analytical study design includes case control study. There are again three types: case control, cohort study, and cross-sectional study. Case control, cohort, and cross-sectional. Let us see how it is done. Analytical. Remember this case control, cohort and cross-sectional, these are the types of analytical observational study. Okay. What is case control? It is also called as a retrospective study. Very important word. That is study of the past. Study of the past. Things happen. For example, cases of ulcerative colitis and control group will be there. Control will be people not having colitis in the Pune city. This experiment I have made. I want to find out ulcerative colitis patient in causative way. What may be the causes? So I have taken the patients who have already the ulcerative colitis since last 2, 4, 6 years, and I also taken the group which do not have the ulcerative colitis. Okay. Then what I did, I asked their lifestyle. I have taken this ulcerative colitis patient, asked about their lifestyle, asked about their eating habits in the last 10 years. Eating habits. Then researcher found that ulcerative colitis patients have consumed a lot of meat with compared to the control group. Two groups, case group and control group. Case and control. Remember these two words. Case means patients. Control means without disease. Control group means without disease. Case means with disease. With disease, without disease. With disease, without disease. And then finally, my researcher conclude that there is a relation of eating meat and occurrence of ulcerative colitis, because they found that the people who don't have the ulcerative colitis, they had not taken meat as like the patients who have the ulcerative colitis. But we have taken the cases, known cases of ulcerative colitis. They are already there. So past. It is not present or it is not future. It is already existing diseases. So it is called as a case control study. Similarly, many relations in between causative factors and disease occurrence can be proved just by collecting data by proper history taking of cases, patients, and control group without disease. I have given a lot of examples. Lot of research work has already been done, and some research work you can do or any person can do. Smoking and lung cancer. Take the patient of lung cancer. Ask the habit. Take the cases patients who do not have the lung cancer and ask about their smoking. Control should be always there. Tobacco chewing and mouth cancer relation. Comparison. Alcohol and liver disease. Eating too much sweets and prameha, madhumeha, diabetes mellitus. Ayurvedic research. Case control you can do. Eating too much salty and graying of the hair or the baldness. Take the patients who have the premature graying, premature baldness and ask their eating habits, whether they had a liking of salty food. And patient having the dense hair and their habit of eating the salty food. Eating too much sour and anemia. Because Ayurveda has mentioned anemia as a cause of Rakta Prakopak Aharya. So sour taste can Rakta Prakopak, Amla, pickles, eating too much salty and Vata Rakta disease, rheumatoid arthritis. Okay. So these are the examples of case control. In this research study, persons with a given disease is called as a case, and population, that means society members without disease, are called as a control group. The research will study various factors in these two groups to test the hypothesis. In this research study, disease has occurred and research study proceeds backwards to find out the cause of the disease, which is compared to the control group. What is control group? People without disease. The control group should be from the same population and matching well for the age, gender, socioeconomic class, and all other factors. For example, I have found that 45-year-old lady has a rheumatoid arthritis. I have taken that lady as a case. Then I should ask her husband, who don't have the rheumatoid arthritis, age group around 47, near about same age, living in the same house with same socio-economic conditions. So always when you take the husband, take the non-control group as a wife. If wife is a patient, husband is a control group. Mother and father, brother and sister, this can be the best combination as a case and control. Okay. In control group should be from the general population, neighboring areas, but not from the hospital to avoid the selection bias. Ratio of the number of cases and number of control should be 1. For example, 30 patients and 30 without disease. So same should be there. But if the study group is small, say below 50, then control cases should be double to that of the number of cases. That means your statistical sample size has coming 50. Then control should be 100 or 150. It is not same if it is 50. Okay. What is cohort study? This is called as a prospective, now in future. Case control past, cohort future. This is called as a prospective study, the study of the future or longitudinal study. What is meant by cohort? Cohort is a group of people with common characteristics. Cohort is a group of people having same characteristics, same disease. Group of the people, okay? Not a difficult word. This cohort is identified before the appearance of disease or observing the people who are at present free of disease. At the moment, they don't have disease. We want to observe these people. The researcher will observe these individuals for a certain length of time and will note how many people of them get the disease and how many of them are not getting the disease. They will test the hypothesis by comparing two groups, that is, who get the disease and who do not get the disease. Okay. In cohort study, first researcher registers the people without disease. Then researcher observe these people for 15 to 20 years in future. This is difficult research. This is a difficult research. Cohort study is always difficult, remember. And see how many of these get the disease. Then he tests the hypothesis by comparing two groups, that is, who get the disease and those who do not get the disease. Let us take an example. Ayurveda is claiming that proneness of the disease according to Prakriti or the biotype. For example, Vata Prakriti people are prone for arthritic problem. For cohort study, register 100 cases of Vata Prakriti having age 30 years. Then observe these 100 cases or person for next 5, 10, 15, 20 years with periodical clinical and laboratory examination. After 20 years, researcher will analyze the data to see how many Vata Prakriti people have got the arthritis and how many Vata Prakriti people do not get the arthritis. Then only researcher can prove that Ayurvedic hypothesis of proneness of the disease is correct. So if we want to claim our Ayurvedic statement, we must do this type of the research, cohort study. Now, third, observational study, cross-sectional study or prevalence. This is only one time examination of cross-section of the population, a limited group of the people from the society at a particular point of time. This is single time study. Point prevalence is estimated at that particular time. Prevalence means kiti pramana, how much quantity, how much quality that is existing, that phenomena is existing. Incidence rate cannot be determined and trends cannot be studied. For example, I have given already examples. Possible uses of cross-sectional studies. Diagnosing or staging a disease, whether community spread of corona is there or not. We want to observe community third stage is occurring or not. Once time study, you just collect the information and then you can decide only one time. It is not past, it is not future, it is present study, cross-sectional present study. Okay, case control, that is a past retrospective, cohort prospective, and this is present study. Evaluating different methods of doing the same thing. For example, examining the relationship between the histology slides and MRI finding of deceased carotid arteries. Brain study. Carotid artery, if I want to study, whether histological slide examination will be better or MRI will be better. So it is a one-time study, present study. Okay. Possible uses of cross-sectional study. Establishing norms. Establishing the norms, lab values from normal subjects. Next, survey. You can use pre-existing validated surveys to learn what people think. How is the mental condition in the lockdown period in the month of April 2020, one-time study, that is a cross-sectional study regarding the corona, lockdown, and the patient psychology. Okay. For example, occurrence of asthma in the first week of June in Shivajinagar area of Pune city. The researcher observes asthma and various other parameters like age, prakriti, etc. Then researcher compare the data with subgroups like age, prakriti, and test specific hypothesis. Hypothesis is Kapha prakriti people are more prone to asthma in the month of June. And only month of June I have collected the data, present data, and then I have made a research. Okay. Cross-sectional study is a single examination study. Identifying the risk factor is the first motto of this study. Occurrence of corona in the people who traveled to the foreign recently after corona pandemic. I have already examined. It is useful to find the prevalence rate of various diseases and to formulate the hypothesis regarding the etiological factors. Then India has made a hypothesis. No, corona has a relation between the people who have traveled foreign countries where already corona was there. Okay, so this is a even strategy purpose. You can observe this. Experimental study, now interventional. This is another sector, interventional. This is not only observation, intervening the human life by performing some experiments. For example, measure the vital capacity of 100 volunteers, pulmonary function test, vital capacity. Okay, train and ask them to do the Anulom and Vilom pranayam. Anuloma Viloma pranayam every day for 3 months and again measure the vital capacity and check whether there is any difference. So we can prove that vital capacity can be increased by doing regular pranayam. But here I have intervened. I am not observed only. I have asked the people to do the pranayam. So that is called as intervention in the life of the people. Next is the clinical trial. This is an intervening the disease process by use of some medicines or some procedures. For example, this was my MD Kai Chikitsa subject. Use of tablet Amrutadi Gugulu. Amruta is a Gulvel, Guduchi, Tinospora cordifolia. 5 milligram tablet, single tablet, 3 times in a day in the rheumatoid arthritis patients as an analgesic and anti-inflammatory medicine. So here I have given some medicine. I had given some medicines. I intervene the disease process. I have not only observed the patient. I have intervened. Similarly, use of Shirodhara in the patients of insomnia. You take the insomnia patients, you ask them to do the Shirodhara, and then you note the first day finding or 0-day finding after 15 days, after 1 month, how they are getting benefited or not. So you have applied some treatment. That is intervention. Remember, doing some experiment, intervention, doing some medicine, intervention, giving some treatment, intervention, not only observation. Okay. Next, animal experiment. Intervention is done by using animals as for the experiments. These are basically done to understand side effects or toxic effects of the new medicines which are not being given previously. Then we have to do first animal experiment before starting human trial. This is very well understood by the research world that human life is a precious life. Human life is a precious life. So before sacrificing the human life, you can sacrifice the animal life. Even corona vaccines, ideally, it is expected that whenever anybody will invent that corona vaccine, it should be first tested on animals and then human trial should be conducted. Now some researchers are making debate on this and they say that China or some people are bypass, not doing animal experiment because they see it is very urgency. We will directly give it to the human being. But ethically it is not correct. First animal experiment. For any new molecule of the medicine, it is always better to do animal experiments before human trials. And my Agada Tantra department, medical jurisprudence and toxicology, Ayurvedic Agada Tantra department is always performing many of their experiments which are related with the poisons, which are related with the toxins. They are doing it on the animal. For example, scorpion bite. Okay, so some paste is there, some medicine is there. So they will do something similar to that, what you can say, the bite of the scorpion, that particular toxin will be pushed into the animal and some antidote will be given. And we'll see what will happen with that particular medicine or the external remedies. Okay. So it is mainly concerned with to study the toxicological effects or side effects on the LD50, lethal dose. You know, you must know this term, LD50. What is that LD50? Lethal dose, where the 50% animals are died or dying or sacrificed. Okay. Now, laboratorical study. Antimicrobial activity of Ayurvedic medicines can be tested in the laboratory. For example, testing of antimicrobial activity of Nirgundi, very famous Svedana analgesic drug, which we always give for the Vatagna treatment. But Nirgundi is also having antiseptic. Turmeric you can take. Kadunimba, Azadiracta indica, Sheuga. There are hundreds of the antimicrobial medicines available in the Ayurveda. So they are tested as a anti-streptococcal, anti-staphylococcal activity, anti-E. coli activity, anti-microbacterium tuberculosis activity. So we must try to find out this particular thing by doing laboratory studies, by making artificial colonies. I think this is nearly end of my this topic of research study design. At any time, our stipulated time will close. But before that, I will again go to my first slide where you can see the main types. So you must, when you write down the LAQ or SAQ for research study design, it may be total LAQ or it may be some, you will be asked only write about experimental study. You may be asked write about different stages of clinical trials. I'm going to discuss in detail afterwards. But this is a LAQ, a brief understanding. You may be asked cohort study in the oral, viva, or it may be the SAQ for you. Case control, maybe SAQ. But whole this question is related with LAQ. Mainly there are two types. One is observational and another is the interventional. When I do not give any medicine, when I do not give any treatment, when I do not take the blood, take the sputum, any herbs and going to the laboratory, no, nothing I am doing, then it is observation. Mainly it is two types: descriptive, where I do not have any hypothesis. Are you understanding? Where I do not have any hypothesis. And another is a analytical, where I have the hypothesis and I do that particular thing. Case control, there are two words. One is a case. Case means deceased person and control means without disease. Remember always, control group and the standard group. Okay, standard means where we have taken the deceased person. Cohort study. What is cohort study? We have already seen. That is the prospective, PROS, in the future. In the future. For example, about the corona, what you can discuss, what the cohort study can be done. I want to see whether there is a recurrence of this corona infection in these affected people. So I will observe already diagnosed, already treated corona patients for next 1 month, 2 months, 6 months, 1 year, and then after 1 year, 2 years, 3 years, I will say no, corona cannot recur. Corona cannot recur. It will not come again. You understand? But now in the China, it is found the patient who are already cured are getting again that particular infection. So that is not a permanent protection for your body, like our measles. So this is a cohort study. We have to observe these people for a longer time. Whether how may be their immunity in the future, we have to study it. With the corona, we can do a lot of research as a cohort study in the future. But we do not have to give any medicines. Remember my word. We have to just observe them for their psychological problem or for their physical problem. for their emotional problem, what is going on for the next 2 years. Okay. Then cross-sectional, single study present at the moment. Now, 27th of April 2020, Professor Deshpande is talking with you at 1 p.m. and I have decided, my college, my institute has decided, in the sector 27, I will make a survey, I will collect the information, and I will see how many people are affected with the corona as a positive test, how many are suspected cases, how many cases are quarantined in this particular 24 hours. So that particular account of 24 hours is like a cross-sectional study. Whatever the figures that you are seeing in the news of the channels or the newspapers or the data published by the WHO. For example, yesterday in America, there were approximately, say for example, total 8 lakhs cases were there who has given the positive corona finding. So that is a one-time study. Next day, the information will change. So the single one-time, time span study is called as a cross-sectional study. So this is a little bit past study. This is regarding the future study, and this is the present study. But all these are the observational types. And intervention, you are doing some experiments, different experiments. Okay. For example, physiotherapy. Okay. And then in the physiotherapy, to my patient of frozen shoulder, I will ask them to do some specific tadasana. Okay. Every day, 3 times in a day, for 5 minutes each time, or some rotatory movements. I am doing some experiments. I am not observing the patient of frozen shoulder. I ask them to do something. That asking them to do something is an intervention. Here I think spelling is wrong. Interventional. Interventional. To enter into the life of the person. Clinical study is the most popular study. Many new medicines are coming. They are testing for their efficacy. Many medicines are tried. I have already examined Amrutaji Gugulu. I have tried for rheumatoid arthritis. Arogya Vardhini and Kumari also. I had made a clinical trial for the infective hepatitis patients. Then animal study. Animal study is a prerequisite before your clinical study. Actually, I should write down animal study before and then clinical study. Because if you understand the procedure of drug development, there is also one question regarding the drug development. Write down drug development. How the new molecule, new medicine is coming into the market. So in that particular process, in that particular protocol, in that SOP, standard operating procedure, animal experiment should be done first. And then clinical trials or on the trials of the human being should be done. That is called as an ethical practice in the research. But there are some debates, there are some, what you can say, the bypass. For example, if I want to try for Suvarna Malini Vasanta as a preventive measure to prevent the corona recurrence. Write down. I want to prevent corona recurrence in any patient of corona. So I may advise him for the poor patient. This category is very important. For the poor patient, Vardhamana Pippali Rasayana, I will advise. Vardhamana Pippali Rasayana. But for the rich people, I can advise Suvarna Malini Vasant, 1 tablet 2 times in a day. So these experiments I will do for 1 month or 15 days, and I will continue to take the record, to take the feedback with some investigations, with some clinical examination, and then I will note it. Because of my Suvarna Malini Vasanta of Ayurveda, because of my Vardhamana Pippali Rasayana of Ayurveda, I can prevent the recurrence of corona. Now see, actually I should not do like that. I should not. For example, the people are talking Shvasa Kasa Chintamani. Write down. Shvasa Kasa Chintamani, most powerful drug to control the breathlessness, dyspnea, lung failure in these corona patients who are expected to go onto the ventilators, who are expected to go onto the ventilators. But before putting them on ventilator, actually many Vaidyas are recommending that this patient should be given Shvasa Kasa Chintamani tablet by rubbing into the honey and ginger juice. Fresh ginger juice and honey, you make a paste and give it for 3-4 times in a day. Shvasa Kasa Chintamani tablet. But this particular recommendation at the moment is not directly government is agreed to apply in the patients. There may be something that ethical consideration, whether your Shvasakasa Chintamani has been done or has been completed, the animal experiments, whether you have done some artificial lung failures in the animals and given this Shvasakasa Chintamani, have you published that paper in the peer-reviewed journal? Then they modern technology, modern researchers all over the world, they are agreed to accept your proposals. At the moment, they are a little bit, we will think, yes, we will can try for the preventive, we will do. There is some hitch. So this can be happening because of the lacking of animal experiment. Because we believe that as they are given in the Ayurvedic text, these are Charaka Sushruta Vagbata, they have already made a lot of observations and they have done already the research. So we need not to do the research. But actually, research is expected as a revalidation. Write down that word, revalidation. So at least for crucial or very, you can say the delicate type of the treatments, a serious type of the treatments, animal experiments should be conducted immediately for this Hemagarbha, for this Yogendra Rasa, for Shvasakasa Chintamani, any strong metallic Rasaushadhi, it should be tried on the animals first. And then I have already discussed about laboratorical study that can be done for hyperlipidemia, antimicrobial activity, so and so forth. So my dear friends, this is my end of this today's topic of research study design. I hope you are enjoying, or rather you will enjoy. Many people are not joining because they will see the videos on the YouTube. And thank you very much for your patience hearing. Today itself, I will meet again to you at, say for example, 2 p.m. for the respiratory problems and 4 p.m. discussing the research questions papers of the Sharira Kriya Vigyan. So thank you very much and take good care of yourself. I am closing this particular session. Thank you.